I'm here.
I do have you noted, Commissioner Taylor.
Okay.
Thank you.
Can you talk to me again so I can get my volume?
Yes,
Okay, that's good. Thank you.
you're welcome. And Kim should be logging on shortly.
Okay.
For the record, Astrid, we do have enough commissioners for quorum. So
Okay.
as soon as Kim is on, we can go ahead and proceed, or I can go ahead and proceed with the ground rules.
Right. Why don't you read us the ground rules and then we'll move right on to the roll call.
All right, thank you so much. Good afternoon, members of the board and public. Before we begin today's meeting, I'm going to be going over some important information. As you are aware, under AB 361, members of the First Five LA Board of Commissioners and staff have been participating in these meetings via teleconference during declared emergencies through January 1st, 2024. In the interest of maintaining appropriate social distancing, members of the public may observe this meeting telephonically or otherwise electronically as posted on our website and this agenda. Regarding public comments, there are two ways to submit public comments. The first way is written public comments via email, and these have to be submitted in advance of the meeting before 1:30 p.m. the day of the meeting to my email at lvo@first5la.org in order for them to be read aloud during the meeting. And as a reminder, public comments emailed should indicate the item number the comment corresponds with. Any public comments received after 1:30 p.m. will not be read aloud during the meeting, but they will become a part of public records. Now, during the meeting, public members can use the Q&A chat function to express an interest in speaking to an item. And it is important that these requests to speak be submitted via the Q&A chat box before the item being commented on is presented. And when submitting requests to speak, public members are asked to only provide his or her name and the item number the comment corresponds with. All public comments received during the meeting via the Q&A chat will be addressed in the order they are received. And when public members do hear their name being called, they will be given the ability to speak during the meeting. And we will give them two opportunities with their name being called before we move on to the next person. 2 minutes are allotted for each comment, and once 2 minutes are up, we will move on to the next public comment. And before we do begin today's meeting, a reminder of the following. To minimize background disruptions, all board members and staff should place their lines on mute until called upon to speak. And to minimize multiple people speaking at the same time and to ensure for a coherent dialogue, board members can use the hand raise or chat box function to express an interest in speaking. I will then coordinate with Astrid, our committee chair, and call your name in the order that it is received. And if technical assistance is required during the meeting, you can contact me at 213-276-9389. And with that, I will hand this back to our committee chair, Astrid.
Thank you, Linda. Can we go ahead and proceed to roll call and then on to item 2 after that?
Yes. Judy Abdo.
Here.
Deborah Allen.
Here.
Maricela Ramirez.
Here.
Carol Segala. Romalis Taylor.
Here.
Robert Hurd.
Here.
Carla Pletez Howell. Deanne Tilton.
Here.
And Astrid Hager.
Here.
Quorum is present.
Thank you, Linda. Our item 2 is a review of the Program and Planning Committee transcript from June 23. This is strictly for information only. Are there any comments on the program or the transcript of that meeting at this point? If not, we will move on to the annual audit. I don't see any hands. Do you, Linda?
I don't. So hearing none, we will receive and file these meeting notes.
Thank you. Item 3 is the draft of the annual comprehensive financial report, including the independent auditor's report for the fiscal year ending in June 30th, 2022. And we'll just move. I'm sure they've choreographed their presentation between the three of them. And so I welcome, is Faustino, are you starting, or how I'll let you go ahead and take charge.
I will go ahead and start, Commissioner
thanks,
Hager,
Ron.
and
Yeah.
thank you for the invite. Good afternoon, committee members and members of the public. Before you today, as Commissioner Hager reflected, we are presenting to you as an information item the Commission's annual comprehensive financial report for fiscal year 21-22. This report reflects the financial activities throughout the prior fiscal year and represents the fiscal condition of the overall organization as of June 30th, 2022. As part of the audit engagement, we work together with our auditors, and they are focusing on testing management's responsibility in the preparation of the financial statements in accordance to accounting principles, which includes the design of the statement that's before you, implementation and maintenance of our internal controls that are relevant to producing and the presentation of these financial statements. I am proud to announce for fiscal year 21-22 that we do have no findings and it is a clean audit. I think it's just a sidebar note, through the course of the engagement, as I said, we work very closely with our auditors. And whenever there is an opportunity to look at some of our internal controls, they do raise any areas where they see where we can improve. For fiscal year 21-22, the auditors did identify some opportunities and have made some recommendations for the HRTM staff to consider related to some of the controls that are currently in place related to wet signatures versus those controls to our electronic signature process and access. And though this is immaterial in nature, the reason why I'm highlighting this is to provide the commissioners and our committee members an example on how we engage with our auditors in different ways throughout the audit process, and how we as an organization are really leaning into this, our fourth strategic priority as we optimize our effectiveness within the Center of Excellence or within the admin function, specifically finance in this example. So at this time, I would like to pass the torch to Faustino Henio to present the fiscal year 21-22 annual comprehensive financial report. And then from there, we will invite Kanali Sakushiam, who is the partner from Eide Bailly, assigned to this year's audit engagement, to fulfill some of her audit requirements, the SAS 114, which is part of the Statement of Auditing Standards. Tino, please take it away.
Thank you, Raul. Let me share my screen at this time. Okay, can everyone see my screen? Thank you. Good afternoon, commissioners. First 5LA and guests, my presentation today will include a brief summary of our fiscal year 2021 award from GFOA, an overview and journey of the annual comprehensive financial report, and a brief discussion of the independent auditor's report. I will also cover fiscal years 21-22 highlights, as well as 3-year comparisons of the trends that we are observing. Before I end my presentation with next steps, our CPA firm's partner, Kanali Sakushiam, will say a few words about our audit, and then we can take questions and comments that you may have. The Government Finance Officers Association of the USA and Canada, also known as GFOA, has awarded the Certificate of Achievement for Excellence in Financial Reporting to First 5LA for its annual comprehensive financial report for the fiscal year ended June 30, 2021. This report has been judged by an impartial panel to meet the high standards of the program, which includes demonstrating a constructive spirit of full disclosure to clearly communicate its financial story and motivate potential users and user groups to read the annual report. The Certificate of Achievement is the highest form of recognition in the area of governmental accounting, and its attainment represents a significant accomplishment by an organization and its management. And this is the 14th consecutive year that First 5LA's financial report has received this award. First 5 California requires each county commission to prepare audited financial statements in accordance with generally accepted accounting principles. This consists of basic financial statements and supplementary statements at the fund level. The presentation of this draft report presented as part of the packet is above the normal reporting requirements set by the California Health and Safety Code and the First 5 California Management Guide. The financial report goes beyond the scope of basic financial statements and state compliance, as well as reflects a detailed view of the Commission's financial position at a moment in time as of June 30, 2022. The audit planning and process takes several months to complete, with 3 phases of interim field work that happened in May with the entrance interview, and in August and September, completing the final field work and reporting. The audit process impacts the whole organization, including interviews with management and staff, as well as confirmation of pending litigation from our legal counsel, as well as diving deep into our accounts payable files to assure the appropriate internal controls are in place. As stewards of public funds, commissioners have oversight and must approve this report to be submitted to the State Controller's Office and First 5 California by November 1st. This report is being presented today for your review and will be presented to the Board of Commissioners meeting in October for approval. Today, I am happy to report that our auditors, Eide Bailly LLP, noted that the financial statements are presented fairly in accordance with generally accepted accounting principles, an unmodified opinion. During Eide Bailly's normal course of performing their assigned functions of the audit, no material deficiencies in internal control were identified. There were no audit findings or judgments. In other words, it's a clean audit. Let's look at 21-22 highlights. Starting with our budget approved by the board in June 2021, the board approved a total budget of $114.3 million. In March of 2022, the board approved a revised budget of $110.4 million, an overall decrease of approximately $3.9 million, which was related to several programs where budgets were adjusted downwards. And total revenue for 21-22 was roughly $68.8 million, which $55.3 million was for tobacco tax. First 5LA also received $18.5 million from Proposition 56, which represents the 2021 fiscal year's backfill, which is consistent from prior year when we received the funds one fiscal year in arrears. Other revenues were $6.2 million, and an accounting entry to adjust the fair market value of our county pooled investment as of June 30, 2022, a negative $11.2 million. Total expenditures were $94.4 million, with $75.8 million of it were related to program expenditures, $6.5 million for operating expenditure related to programmatic efforts, and the administrative expenditures of $12.1 million. And the next 2 slides, I'll briefly talk about our fund balance. This slide defines the different levels of constraints that the board has taken and is aligned with accounting principles and our current fund balance policy. I will not be going over their definitions with each categories, but to remind our commissioners, different categories that our fund balance are assigned to in alignment with accounting principles. This pie chart represents our current fund balance of 287.8 million, broken down by the different constraints that the board has taken action. On the next 3 slides, I will talk about trends and activities that we are currently observing for the last 3 fiscal years. This graph reflects our declining fund balance as we continuously rely on to offset our revenue being lower than our expenditures. As presented in the prior pie chart, fund balance as of June 30, 2022 is 287.85 million, which decreased 28.6 million from the prior year balance of 316.42 million. This slide reflects revenue versus expenditure, which continued a pattern of spending in excess of revenue, which is planned and approved through our budget process. Focusing on 21-22, on the right-hand side of the graph, total revenue decreased from 81.2 million in fiscal year 2021 to roughly 68.9 million in 21-22. As I mentioned in the prior slides, total expenditures of 94.4 million for 21-22 were exceeded total revenue of 68.8 million by 25.5 million. This last graph represents the program versus administrative expenditures as aligned to First 5 California Financial Management Guide. Looking at the right-hand side of the graph for 21-22, the administrative cost of 12.1 million of the total actual expenditures is below the spending cap of 14.1 million approved by the board during mid-year revision. The total program expenditures of 82.27 million for 21-22 includes provided grants and allocations, as well as operations expenditures in direct support of programmatic efforts. Before I continue to next steps and take your questions and comments, our CPA's firm's partner from Eide Bailly, Kanali Sukashim, would like to say a few words about this fiscal year's engagement. Kanali?
All right, thanks, Tino. Good afternoon, everyone, and thank you for inviting me to participate in this meeting. My name is Kanali Sukasam, and I'm with the firm Eide Bailly. We've completed our audit for the fiscal year ending June 30th, 2022, and I wanted to take some time to discuss what our responsibilities are under generally accepted auditing standards, and then also to identify the results of our audit. Our scope of work was to provide an opinion on the Commission's annual comprehensive financial report for the fiscal year ending June 30, 2022, and also to test for compliance with the standards and procedures for audits of local entities and administering the California Children and Families Act issued by the State Controller's Office. We are issuing an unmodified opinion or a clean opinion, which is the highest level of assurance over the Commission's financial statements. As part of our financial statement audit, we considered the Commission's internal controls and designed our audit procedures to gain reasonable but not absolute assurance. We also performed tests of compliance with laws, regulations, contracts, those of which could have a direct and material effect on the determination of the financial statement amounts. In addition, we also reviewed the required supplementary information to ensure that the amounts contained in those sections are consistent with the information that's presented in the basic financial statements. The significant accounting policies used by the Commission are disclosed in Note 1 to the financial statements. There were no significant changes in accounting policies used in the current year. There is one new standard that was implemented this year, and that's Governmental Accounting Standards Board Statement number 87, or leases. The Commission implemented this statement, however, it did not have a material impact to the Commission's financial statements. Further, there were no corrected or uncorrected misstatements found during the audit. I'm also happy to report that there were no difficulties or disagreements with management and staff during the course of the audit. Also, we had no consultations with no outside firm. An example of this would be if the commission entered into any unique financial transactions in which we didn't have the expertise in-house to test those transactions and had to consult with an outside firm. We would have the responsibility to report these transactions out. Lastly, we really appreciate the opportunity of serving as the commission's external audit partner, and would like to thank commission management and staff for their cooperation with the audit process. With that, I'm going to hand it back to you, Tino.
Thank you, Kenali. And for next steps for the annual report, the draft report presented today for your review will be presented to the Board of Commissioners meeting on October 13th for approval. Upon approval, the report will be submitted to the State Controller's Office and First Five California by November 1st to complete our reporting requirements. The financial report information will also be used to inform and update the long-term financial plan. Before I end my presentation, I would like to thank our leadership team and our commissioners for their guidance and support, and also to my colleagues for their support in completing the audit, and our team of auditors from Eide Bailly for their hard work in completing the audit timely. We can take your questions at this time, and I will share my screen.
Are there any questions? I have one question that I'm just sort of harking back to being a recipient of a First Five grant. I think the second year that the commission was in operation was that we were requested to produce for First Five a audit of our financials from our, that had to do with the fulfilling the guidelines and what we had written in the grant. Do we still require that of everyone that we support, like in home visitation or whatever? Do they also have to report back to First Five their own audit or their own financials?
There are some fiscal requirements that are negotiated between each of our individual vendors or contractors. And some of them do have some financial reporting requirements. I would have to go back and look at all of the contracts to see which ones we have specific requirements related to audits.
But is not a standing requirement that they provide you with their audited financials or a financial accounting of how they spent the money we gave them?
On how they spent the resources that we gave them, there is some reporting requirements, yes.
All right, I want to just clarify that in my own mind. Are there any other questions from anyone else on the commission here that wants to ask any questions?
Carol has her hand up.
Carol?
Yes, just to clarify then, so every single grant does have reporting requirements when they're completed, when the grant is completed, or is it fiscally, or how does that go?
So those are all negotiated with each of our vendors. So there's not, I don't want to say it's consistently, but there is a requirement at the end of the year that all contractors and grantees must report on how the resources, First Five resources are used. As for submitting audited reports or financial statements at year end for the entire organization, in some cases, we ask for those upfront before we fund organization to see what their fiscal capacity is. And in some cases, we do that at the end of a project year or a program year. So it does change depending on what we negotiate. But with all contractors and grantees do submit a financial report at the end of the fiscal year on how resources are used.
Thank you. Thank you so much.
All right, so are there any other comments or questions about that?
I don't see any other commissioner hands up.
All right, thank you. So I think we can move on to item 4, which is a review of First Five LA annual report to First Five California that would be interesting. So Hari Kim Han is going to give us some information on that. Take it away.
Thank you. And before we continue the next item, I wanted to confirm that there are no public comments on item 3.
All right, thanks, Linda.
Hello. Hi, can you hear me?
Yes.
All right. And can you see my screen?
Yes.
And I think my video is frozen. Let me try this. Okay. Hello, good afternoon, commissioners. In adherence to Prop 10 funding requirements, First 5 LA submits a report to First 5 California on an annual basis. Today, I'll be summarizing the fiscal year 21-22 preliminary annual report findings and in preparation for delivering the full annual report to the board at the October 13th Board of Commissioners meeting. Supporting our state annual reporting work are Limor Zimskin and Kari Parsons from Data Link Partners. So I'll begin by providing background on the state annual report, then transition to reviewing the preliminary results. I will then provide a summary of the key takeaways and conclude with an overview of next steps. So let's begin with some background information. As you know, First 5s are funded through Prop 10, and one of the funding requirements of this legislation is a state annual report. In order to generate this report, First 5 California collects data from each First 5 county commission. And there are 3 types of data that First 5 California requests: data related to revenue and expenditures, which you just kind of heard about in our last agenda item, data on populations reached and their demographics, and a summary of evaluations conducted and key highlights and accomplishments from each county. Once the data from all 58 counties is received, First 5 California synthesizes this information in a single report. You may remember that back in June, commissioners approved the receipt and filing of First 5 California's fiscal year 2021 annual report, which is available through the First 5 California website. Today, I'll be focusing on preliminary findings, which includes information on the number of grants and populations reached through our investments. The full report will be provided as part of the board materials that will be posted on the Friday before the October board meeting. So you may be wondering where First 5 gets the data we need to submit to First 5 California. There are 3 sources of data in this organization-wide process that are combined to generate the First 5 LA's report. First, survey grantees gather information on the populations they have reached and key accomplishments from the past fiscal year. We also report data gathered through our annual financial audit, which you just heard about from my colleagues on the finance team in the previous agenda item. Finally, we work with other First 5 LA staff to summarize evaluation activities conducted within the fiscal year. First 5 California also requires that investments be categorized using First 5 California's 4 result areas. The child health investments are those that provide services and supports to improve child health. Investments such as Welcome Baby and select home visiting programs fit here. Child development investment are those that provide funding for and improve early learning programs. Our ECE Workforce Registry and Quality Start Los Angeles investments fall in this category. Family function investments provide either short-term or intensive family supports, and our Little by Little early literacy program is an example here. And finally, our systems of care investments are those that focus on policy and public advocacy, as well as systems building efforts and emergency and disaster relief. So our Best Start Regional Network grantees, policy advocacy funds, and Help Me Grow LA are examples in this category. It is important to note that First 5 California result areas do not align with our current strategic plan, and they provide an additional perspective than our typical approach to telling First 5 LA's story. And this brings us to our preliminary fiscal year 21-22 results. I'll focus on how grants were distributed, the number of children, families, and providers reached, the age, race, ethnicity, and primary household language of children reached by First 5 LA's investment. Consistent with our fiscal reality, there were fewer grants overall. In fiscal year 2021, we had 135 programmatic grants and 102 in fiscal year 21-22. We have fewer grants across all 4 first 5 California result areas. These bars are showing us proportion of grants that fell within each result area. We continue to fund a greater proportion of systems of care grants, with 57 out of 102 or 56% categorized under here, which is expected given First 5 LA's strategic direction as a systems change effort, a systems change agent. On the other hand, First 5 LA continues to shift away from direct service investments. There were a greater decrease in the number of grants categorized as child development and family functioning than other result areas. First 5 LA was strategic about scaling back and sunsetting some of our direct service grants in order to be responsive to our fiscal reality and emphasis on systems change. For example, the early care and education team shifted the focus of investment from center-based care and providing direct services to home-based childcare and systems-level strategies. Though the number of grants decreased for child health, the magnitude of the decrease was not as high as with child development and family functioning, so the proportion of our funding within that category looks to be higher than fiscal year 2021. We will now look at the populations reached through our direct service grants. Compared to fiscal year 2021, First 5 LA investments reached a greater number of children and primary caregivers in fiscal year 21-22. The biggest contributor to this increase came from one grant, our Little by Little legacy investment, which reached over 13,000 more children and 46,000 more primary givers compared to fiscal year 2021. When looking at the numbers of providers, there was a decrease of over 2,500 providers reached compared to fiscal year 2021. The primary reason for this decrease is the sunsetting of the Mental Health Incubation Academy program, which served around 2,600 providers in the previous fiscal year. When breaking down which programs reach children and primary caregivers, we can see that the Little by Little investment early literacy program accounted for over half of the children and parents reached. It is important to note that our investment in the Little by Little legacy program is set to end this fiscal year. In addition, the Welcome Baby program, which provides hospital and home-based interventions, accounted for 24% of children and 40% of parents reached. The investment that reached the most providers in fiscal year 21-22 was our ECE Workforce Registry. Over 19,000 ECE providers in LA County participated in the registry by doing things like registering for professional development trainings. Similar to the Little by Little, our investment in the registry will also be ending this fiscal year. For the next 3 slides, we'll be focusing on the child demographics. Looking at the age of children reached, the majority of children reached through First 5 LA investments continue to be less than 3 years old. This is aligned with First 5 LA's emphasis on prioritizing supports during the critical development period that occurs prenatal through age 3. This slide compares the race and ethnicity of children reached through First 5 LA investments to LA County children birthed through age 5. In fiscal year 21-22, more than 3 in 4 children served through First 5 LA investments were of Latino and Hispanic background, which is a higher proportion compared to LA County children. However, several groups were underrepresented, including White, Asian, Pacific Islander, multiracial, and American Indian and Alaskan Native children. This slide shows the comparison of the primary language spoken in homes of children reached through First 5 LA investments and LA County households with children younger than 5 years old. Please note that the census data reports on households that does not speak language other than English at home. So the 34.3% here refers to LA County households that speak only English and does not include multilingual households that speak also English. English was identified as primary language spoken in homes for about 2/3 of children reached by First 5 LA investments. There was an underrepresentation of households where Spanish and other languages were the primary language. So, although we are reaching Latino and Hispanic children, grantees are reporting that majority of the children come from households where English is the primary language. One consideration is that grantees only report on the primary language at home. So families who identify English as their primary language might be in multilingual homes, but this information is not gathered. Another consideration is the comfort level of caregivers responding to the question about primary language. They might feel stigmatized or discomfort in identifying another language other than English as their primary language. With that said, I will summarize the key takeaways and discuss next steps. In reviewing the preliminary findings, there are 3 key takeaways I'd like to highlight. First, consistent with the 2020-2028 strategic plan, First 5 LA investments are increasingly focused on improving systems of care. Related to this point, I'd like to note that First 5 California currently does not collect detailed data on the systems change work being done by First 5 county commissions. And there needs to be revisions to the content to reflect the evolving work of First 5 county investments. This will allow us to tell a fuller story of what we are doing to change systems. Second, the majority of children reached through First 5 LA investments are younger than 3 years old, which is consistent with our emphasis on prioritizing the critical period of development that occurs prenatal through age 3. Finally, the First 5 LA investments are reaching more children. There is an underrepresentation of children across all race and ethnicity, with the exception of Latino and Hispanic and Black and African American children. There is also an underrepresentation of children from households where Spanish and other languages are primarily spoken. Before we transition to our discussion, I'd like to give an overview of the next steps for the state annual report. First, we will finalize the report content by incorporating the revenue expenditure data and county highlights. Next, we will present the complete report at the October 13th Board of Commissioners meeting and request approval to submit the full report to First 5 California. Finally, upon receipt of the approval from commissioners, we will submit the report through First 5 California's data system by the October 31st submission deadline. So with that said, I would like to open it up for discussion. We are curious to learn about what questions you have, as well as what your reactions are to these preliminary findings. Thank you.
Commissioner Taylor has his hand up.
Commissioner Taylor, you have the floor.
First of all, thank you for the great report. You do it every year. Really appreciate your efforts. My question is how successful are we getting the state to change the indicators so that they're recognizing the great work that this team is doing to engage systems change on behalf of children and families. So where are we with that? Just my first question. And second, how are we working to outreach to other multilingual families to engage them on the services we're trying to deliver to the community? An example would be for home visitation, welcome baby, and things like that, so that we can bring them into the fold as well to what we're trying to achieve. So I will step back and let you respond.
So I'm going to start off, and Hari, feel free to add, and others who have involvement in conversations at the state, feel free to chime in. Thank you for those questions, Commissioner Taylor. There have been conversations over a number of years with the state about the data that is being shared as a part of the annual reporting process, and really highlighting the disconnect between the emphasis on data around direct services versus systems change. As you may be aware, there's recently been some changes in leadership, both at the First 5 California Commission, as well as among staff, as well as among the board. And so those conversations are ongoing. There is an expressed interest in shifting, but I think that there's still some thinking through of what that framework would look like. What does it look like to capture information about systems change that isn't so county specific? Because there's still a need to aggregate up. So there are ongoing conversations about what that can look like. I don't think that we are close where we could say, you know, next year the reporting is going to look different. I will share that we are working locally to think about how we can collect data, additional data beyond what the state is asking for from our grantees, so that we're able to tell a fuller story about what's happening locally. And we intend to use that in conversations with the state about how they might shift their reporting requirements. So we know there's some conversation happening at the state level, and we're going to try to take maybe a ground up approach to say, hey, here's one way that we are doing this locally in LA County. And we're going to be doing some of that this year. And so when we come back to the commission next year to submit the final report for 21-22, we'll be sharing some of what we're learning locally and how we can use that to influence what's happening at the state level.
And I would just add, Commissioner Taylor, thank you for the question. There's a definite interest and openness on behalf of new leadership at First Five California in stepping back and taking another look at the report with a focus on really further developing a common definition of systems change with an eye towards being able to more accurately and completely capture the good work going on across the county commission. So more to come on that. And I see Deanna is there's on camera and maybe has some thoughts to in response to the commissioner's comment about multilingual efforts within our family strengthening work.
Yes, I just wanted to add for that. Thank you for that question, Commissioner Taylor. We do have strategies in place to always look at how we broaden access to families from different groups. As an example, Long Beach, there's a Khmer population, and there's a Khmer outreach specialist that works with Welcome Baby to do specific outreach. And so depending on the region and the needs, we have worked with sites and to look at kind of the broader need and to try and hone in on specific strategies.
I just think it's going to be important that we tell some, if we can't put the data together when we talk to the state, we can talk about the stories you're already collecting of the impact of your effort. And that's going to be very important that we do both, capture data and tell the story. So hopefully you're doing both. So thank you very much.
Thanks, Ramelis. I see that Commissioner Tilton also has a comment.
Astrid, and thank you for leading this committee. Appreciate it. I note, and I have for some time, that we're primarily serving English-speaking Hispanic families and not so much the Spanish-speaking Hispanic families. So I'm wondering how we are addressing the immigrant community, which would be primarily Spanish-speaking Hispanic families, because of the isolation, the risk to those families, and of course, the very critical need for services such as home visitation by people, by providers who are also very capable of communicating in their language.
I can't specifically for home visiting as one of our largest direct service investments. Commissioner Tilton, I would say that many of the staff that's hired are bilingual, and we always ask families what language they prefer services in. And many of them, even though they're Latino, will say that they prefer English. So we continue to track that, but we have a broad number of staff that are bilingual, and we always try to match families to the needs so they have someone that can speak to them in their language. And I know on the county side, we're required to work with families regardless. We do include funding for sites for translation if needed to work with other families if we don't have someone that speaks that specific language.
I agree, and thank you, Deanna. I guess I'm asking how we might better reach the families, the Hispanic, Spanish-speaking families, since we do have a majority of English-speaking Hispanic families. How might we better reach out to the Spanish-speaking community? And I again voice my concern about the immigrants who are fearful of any kind of intervention.
Yeah, I know that that's a process of communicating messages for families, letting them know that services are available. You know, word of mouth is very powerful. As Welcome Baby has been in place for a number of years. That has been a very effective method to let families know that they can continue to learn and expand ways to reach different populations.
It's a question, Deanne, that we it's such an important question, and it's one, you know, like with you all, we have the report. These are the preliminary findings. We're lifting up some initial analysis and considerations, and ones that we're going to need to take back and reflect on in the context of our work. So Deanna, I appreciate you lifting up some of your initial considerations in the context of our home visiting work, but it's really a question for us to be reflecting on more broadly. So I think it's more to come. So thank you for elevating it.
Thank you, Kim. And it is a much broader issue beyond home visiting. So thanks.
Commissioners Allen and then Segala.
Deborah?
Yes, thank you. I have to apologize for not being on video. For some reason, my computer decided it's not going to do that in Zoom over the last couple of days, so I'm working on it. But I am paying close attention. I want to both sort of endorse the concern about families who don't speak English. In National Survey of Children's Health, those families come out lower than any other group on virtually every measure of connectedness to services, and also to support the notion that this is a much broader problem than First Five or home visiting, but something we all have to think about collectively because they are such a neglected population. I wanted to ask a related question, which is I noticed in the conclusions that the way sort of the gaps in services were presented had to do with just comparing the rate of engagement with the rate of the proportion of that race ethnicity group in the population. And clearly need is not evenly distributed across race ethnicity groups. And I wondered if and a lot of our, of DPH's engagement with First Five, we think about targeted universalism, about how we reach populations at highest risk. So I wondered if that's a sort of measure that's imposed, that is, that you have to report that way. And it certainly is a reasonable thing to report, but I think more information would come in some ways if it were, if there were some measure of need that the measure of engagement was being compared with. For example, I mean, just a very simple one would be poverty in a particular race ethnicity group and the level of the population reached. So it's just a question about sort of why that choice of what to consider the baseline or the target. And if there is an option, whether something that's more reflective of our efforts to achieve equity rather than equality, recognizing that need is not equally distributed, might be an enrichment to the report.
That's a really great point, and I appreciate you elevating it. The information that we shared this year, comparing the children that were reached through our investments to the demographics of LA County, was in response to questions that we heard from the commissioners last year when we presented similar data, and we only presented the data on who we reached. And so there were questions about, well, how does this compare to the rest of the county? And so this year we brought data comparing to the rest of the county. And to be honest, it's really difficult to get data at the county level for 0 to 5 population, which reflects race, ethnicity, as well as income level, to be able to kind of provide that type of comparison. But we certainly recognize that looking at race and ethnicity does not account for need. And so when we talk about populations being overrepresented or underrepresented, it's really not telling the full story. So we certainly recognize that and continue to look at ways to bring, to kind of give a richer story, a better understanding about who it is that we're reaching. So for example, we know that we're targeting 14 geographies throughout the county. It's possible to look at how who we're reaching compares to the children in those areas, but that would be, sort of a lot more information that the state isn't asking us to report on, but would allow us to kind of put our data into context. So really appreciate that point and completely agree that it does not account for need. And that's something that we'll look at trying to incorporate in the future.
Thanks very much. And I appreciate the challenges.
Was there another hand up that I thought I saw one more hand up?
Commissioner Sagala?
Yes, let me thank you all for the report to begin with. Also, I just wanted a little bit more clarification about the underrepresentation of Asian populations. And maybe what are further steps in regards to that area?
So I'm not too sure what's going on at the programmatic level or in terms of the programs that we are funding, but these are figures reported by the grants and contracts that we fund. And so if there is anyone who could maybe speak to that as well and provide a little bit of context.
Yana, do you have some quick thoughts? I know this has been an ongoing area of attention, particularly in certain of our, with some of our home visiting providers in Best Start communities.
Yeah, I highlighted, Long Beach is one example. I'll highlight where there's a larger Asian population. One of the strategies I mentioned earlier was we hired a Khmer speaking specialist. I think there's specific strategies that have been explored. And I think it's learning about what is that most resonates in terms of having inroads to those groups that's most effective. What we found there that it wasn't necessarily just the language, but it was familiarity with like the elders and the culture that really with the engagement. So we continue to learn and track and trying to see where it is that our investments are located and can kind of engage in different ways.
Your insights will be really valuable. Thank you.
We're going to move on, but I just want to comment. It feels to me also like, since home visitations and a lot of the services we're giving in homes have to be given and, be received voluntarily, that the strategy is a little bit more complicated than wishing ourselves into those homes. Right, Carol? I mean, we have an obligation to be invited in many ways. And there are those cultural barriers rather than wishing that we were in those homes, which we all wish, but their culture and their traditions are not very accepting of many others coming into their homes. So, that's a whole nother strategic planning part of what needs to happen is how do we break down those particular barriers. Anyway, thank you. I love what you said, Carol. Thank you for that. If there are no further comments and there's no public comment on if I'm learning one does thing, and we'll move on to item 5, but only after we've verified that we're clear of public comment.
For the record, confirming that there are no public comments on this item.
All right. So as we move on, we're going to look at the priorities that we had in terms of the past year, 2022 more. Well, we have 2022. We have to get through that first. And we're going to hear from a group here for, and are we starting with you, Charma?
Yes, I would love to start, please. Let me pull up. That work? Good afternoon, commissioners. I'm excited to be here today to wrap up what's already in progress too. So we have 3 goals today. First, we want to share a review of what our policy priorities and advocacy activities looked like in 2022. So where we've been and how the opportunities we prioritized in our roadmap at the beginning of the year played out. As context to our second goal, as you'll hear shortly after this presentation, we're continuing our strategic plan refinement efforts. So we know the refined outcomes will focus and narrow our shared priorities. And in 2023, we will have a lot of work to do to align, integrate, and develop new strategies, which will include our new approach to the policy and agenda and goals. So not to get Ahead of those outcomes and efforts, we're recommending that we continue the same 2022 policy agenda priorities into 2023, which represents the high-level priorities that align with our strategic plan goals. And third, we're also presenting information on the procurement for our state advocate to represent us in Sacramento. So we will dig into detail and priorities and specifics in just the next slide, but I want to start with a context framing because our political environment has been complicated and swirling. In the state context, we had another year of record budget surplus and spending. We had a nearly $100 billion surplus, and the legislature adopted a record $300 billion spending plan, which I still can't believe we're saying out loud. But the 2022-23 budget prioritized one-time investments over projects that were ongoing funding in anticipation of potential recessions on the horizon. We're watching a few of our priorities still on the governor's desk as we tick down the clock to veto or endorse by September 30th. It's also a year of change in Sacramento. There were an unusual number of retirements and some resignations in the middle of their term. Both the approaching term limits and the redrawing of political district boundaries to reflect population shifts contributed to leadership challenges, especially in the assembly, and the early transitions that we saw. At least 35 lawmakers won't be back in 2023, and the November 8th midterm election will bring a whole new cohort of lawmakers who could serve in the next dozen years. So very swirly, to say the least. In the federal context, we were busier at the federal level this year, mostly because we had real big opportunities to build upon partnerships and coalition efforts. We saw a number of opportunities and changes in our federal context and pressures. The Maternal Infant Early Childhood Home Visiting Program, the federal home visiting funding, is set to expire September 30th. The Inflation Reduction Act was a slimmed down version of Build Back Better and left out critical investments in childcare and measures aimed at family stability, which included the child tax credit that was expanded last year and the Senate allowed to expire this year. The Department of Homeland Security rolled back a policy instituted by the previous administration that sought to limit immigration benefits. Also, the 117th Congress was the first time Congress has been a majority Democrat since the 111th Congress in 2011. And we're walking into the midterm elections that will bring a lot of new voices as well. Also in November, there will be a special election to fill the rest of the 6-year term necessary after Kamala Harris was elected Vice President of the United States. And I just like saying that sentence. So to take us deeper into our report card and where we've been in the story we tell about the 2022 session, I'll hand it over to our federal advocacy lead and our government affairs strategist, Anais Duran.
Thank you, Sharna. Hello, Board of Commissioners. I'm Anais Duran, and it is a pleasure to present before you for the first time. Within the context Sharna just shared, this past year, the Office of Government Affairs and Public Policy has relentlessly advocated on the state and federal levels to advance our priorities in alignment with the board-approved 2022 policy agenda. I'd like to start by highlighting some of this year's state and advocacy priorities and wins. On the budgetary side, advocating for expansions for the California Home Visiting Program and Black Infant Health Programs was a key priority during this year's First 5 Advocacy Day meetings, and we are glad to have attained ongoing increases in funding for those programs. Another key priority was advocating for continuous Medi-Cal coverage for children under the age of 5. We actively advocated for this as a bill initially, AB 2402, before it was included in the budget. And this really exemplified the importance of a focused advocacy among First 5 LA and our partners, as it was initially not included in the governor's January budget or May revision. Ultimately, we were able to secure funding for 2022-23 and potential ongoing funding contingent upon sufficient general funds. So we will look forward to continue advocating for this coming the next year session. Additionally, a priority of both First 5 LA and the Early Care and Education Budget Coalition this year continued to be the waiving of family fees. While the 2022-23 state budget does continue to waive family fees for an additional year, AB 92, the legislative vehicle to implement a new equitable family fee schedule for families utilizing childcare and preschool services, was vetoed by the governor. Similarly, increasing rates for childcare workers was another critical priority for First 5 LA and the ECA coalition. While increasing rates for providers did not make it to the final state budget, rate reform work began in January to create a single reimbursement rate structure that addresses quality standards for equity and accessibility. Moving on to state legislation, we wanted to highlight 3 bills that passed the legislature and are currently awaiting the governor's signature. The first is paid family leave, SB 951, which would increase weekly benefits provided through the state's paid family leave program. And this bill is important because in doing so, it will allow more parents to take time off work following the birth of a child, provide more opportunities for parent-child bonding, and support mental health. The next one is whole child community equity, AB 2832. And this one would create an equity tool based on a whole child equity framework to guide the allocation of early care and education funding and resources in California. Specifically, this tool would utilize a whole child framework to identify areas of highest need across the state, particularly communities whose lack of EC and other services and supports are heightened by racial and economic inequities. And this last one, It Takes a Village Act of 2022, would establish a 2-year California coordinated neighborhood and community services grant program to implement new and strengthen existing neighborhood and regional creator to career networks by allocating state funding into these programs. And this bill, the support of this bill was informed by our colleagues in the communities team and really speaks to the growth of collaborating across our organization to amplify impact for the children and families that we serve. Looking ahead, the November election, Los Angeles County will see 6 new state policymakers due to limits, resignations, and redistricting. So the entire legislature will see 31 new state policymakers. Because of this, there will be many changes to leadership and committee assignments come January 2023. And so proactively, OGAB will begin engaging the new members of the LA County State Delegation on our strategic priorities and policy agenda. We can move on to the federal side. Federally, things have been active this year. As Sharna mentioned, we've been really busy advocating on the federal level as well. The Inflation Reduction Act of 2022 was signed into law recently. And though it did not include childcare and early learning investments, OGAB worked with the First 5 Network and national partners to elevate the need for and importance of federal funding in this package, and former ones that unfortunately didn't make it out of the Senate. We drafted a letter to our California U.S. senators on behalf of the First 5 Network, and we'll continue advocating for this priority into and in the new year. In regards to the Maternal, Infant, and Early Childhood Home Visiting Program, also known as MIGV, we are one step closer to its reauthorization. First 5 LA has worked with our Office of Communications colleagues, the First 5 Network, and the National Home Visiting Coalition Steering Committee, which we are members of, to advocate for and elevate the importance of the home visiting program. Most recently, First 5 LA met with key members and offices of the Ways and Means Committee to activate them around this issue, and also worked to ensure our entire LA delegation and the committee became original co-sponsors of the MIGV bill before it was announced this past Monday. Yesterday, the bill was earmarked with unanimous bipartisan support, and we are proud to have supported Representative Judy Chu in her remarks with First 5 LA data and talking points we developed in partnership with our family supports team. We'll now be seeking co-sponsorship from the rest of the LA delegation to see the reauthorization through. And I think this really speaks to our continuous engagement efforts and relationships we've built over the years in Washington, D.C., and the way that we've been able to situate ourselves as a resource and a partner. Also, for several years, First 5 LA actively advocated against the Trump administration's public charge rule alongside the Protecting Immigrant Families campaign and state and national partners. We are happy to report that after a lot of advocacy and coalition work, a new public charge rule has been introduced and finalized by the Biden administration that aims to remove barriers for immigrant families accessing critical early childhood supports that their US-born children are entitled to. So we'll now be working with our colleagues in the Office of Communications to dismantle the misinformation that the previous rule created. Lastly, this year marks the end of the 117th Congress. And so we'll be meeting with our LA delegation this fall and winter months to continue advocating for First 5 LA strategic priorities into the new year. Come the new year, LA County will lose a congressional seat because of redistricting, but we look forward to a fresh start in the new Congress in creating transformational relationships with our new members. And most importantly, continue expanding our national footprint and working with our LA delegation to be front and center when it comes to early childhood issues. And I'll now take it over to Andrew.
Great, thank you. So we wanted to continue by briefly reorienting to the functions of the First 5 LA policy agenda, which acts as the authorizing document for First 5 LA's policy and government affairs work. Specifically, we use the agenda to inform, prioritize, and sequence advocacy efforts primarily at the federal and state levels. And as we've just heard, the agenda recognizes the range of policy vehicles that we pursue, and that includes administrative, budget, and legislative advocacy. It also clarifies the policy priorities that we can engage in. And then finally, prior to engaging in advocacy efforts, the policy agenda also acts as the guide for formal analysis of policy proposals and as our blueprint to develop policy recommendations and inform priorities. So on the next slide, over each of the previous 2 years, members of the Office of Government Affairs and Public Policy have come to the board for your thoughts and your feedback on annual policy agenda refinement efforts. This year, though, we are recommending a continuation of the board-approved 2022 policy agenda into 2023. As commissioners well know, First 5 LA is currently undergoing efforts to refine and clarify our strategic plan. And the Office of Government Affairs and Public Policy believes there should not be any additional policy agenda refinement until refinement work related to the strategic plan is completed. Then after the board approves the refined strategic plan, we can better ensure there's alignment between future policy agendas and that refined strategic plan. Luckily, though, we've set ambitious goals and priorities in the 2022 policy agenda, and the agenda itself represents both short and long-term priorities. And as such, especially with those longer term and overarching policy goals, no single bill or budget item this year would be able to achieve all of the outcomes that are featured in the current policy agenda. So even with the significant wins from this year that Ani has just reviewed with us, we know that there's still much to pursue and accomplish within the current policy agenda. We also feel that the current policy agenda is already timely and urgent. For example, it concurs with the emerging pathway for a strategic plan by recognizing and highlighting the rapid pace of brain development that occurs in the first 5 years of life. It recognizes the need to ensure families receive supports as early as possible and the importance of supporting optimal child development. Finally, the policy agenda is grounded in a commitment to closing disparities and ending inequities that impact many children in Los Angeles County, starting even before birth. So for all these reasons, we feel that maintaining the 2022 policy agenda into 2023 is the best course of action for right now.
Great, thanks so much, Andrew. So I'll try to wrap our team up in terms of our presentation. So really, in order for First 5 LA to continue this work in partnership with others to really strengthen systems of support at the state level for children and families in LA County, the OGAT team worked with our contracts and administration purchasing team to release on August 18th, 2022, a request for qualifications to solicit a state policy and advocacy consultant to really continue this work that we've been doing at the state level. Our current contract with our current contractor for this consultant will actually end on November 30th, 2022. So since 2013 and 2017, First 5 LA has contracted with a state policy and advocacy consultant to support the organization's policy and advocacy activities in Sacramento, really working to elevate those board-approved policy agenda priorities. So the awarded contractor will employ a variety of strategies to support First 5 LA's policy activities in Sacramento, but also really to elevate those priorities that we've all seen within the policy agenda that's outlined with our 0 to 5 focus. Again, OGAP and the CAP team are currently in this process of reviewing applications, and we'll work through the month of September to select a contractor, and we'll recommend to the board to approve a contract at the November board meeting through contracts consent. So in the next slide, you'll see a brief timeline of the work that's being done, that has been done, will be done. As you can see, August 18th, we posted our solicitation out to the public. CAP presented or developed an information webinar for those that were interested in applying for the solicitation. Proposals were due on September 12th. Hopefully, we're working to have a contractor selected by October 5th to ensure that we can bring it to the board for your approval on November 2nd, with ultimately a start date of December 1st, 2002. And again, this work will be done in tandem with CAP as well. So in a nutshell, that is the work we are doing to solicit a new state policy and advocacy consultant. So with that, I will turn it back over to Sharna. Thank you.
Thank you. Thank you, Jamie. To close, we will come back to you in November with a roadmap of opportunities and priorities for 2023, and to ask for approval of our 2023 policy agenda to authorize our work, and also present the recommendation to approve the new state advocate, if that's not enough of a package with a bow for you. So now we'd like to hear any reactions, questions, or comments from you. I'll stop sharing.
Did I see your hand, Kim?
Commissioner Taylor?
Okay, team, another good year. Great job, excellent work. I just want to let you know that from my perspective, I continue to support the great work that you and your team are doing, and ask that we continue on, and I look forward to supporting whoever you guys select as your collaborative partner team. I do want you to do something that I don't think the state will do it, but we have to tell the story about how important avocation is and policy and things of that nature at the state and the federal level. Because, you know, you got to talk about in your memo, how many families were able to be access the services identified for ECE, right? That's very important. I do have a question. Why did the governor veto AB 92? I don't know if you could tell me that, but that's a question I'm having. Then childcare workers, it's essential that those workers are covered as essential workers. So we need to advocate for that. COVID-19 showed us that. And I hope that we need to educate the new legislators how important they were in us surviving that 2-year issue, and how important they were in doing that. And that gets me back to the paying the wage. But there is one thing I don't want you to do is don't stop on the family, friend, and neighbor issue, advocating for that. That's very important, and don't give up on that. And we need to have data that supports where we're going with that, and especially as it reports to optimal child development. Somehow we need to have that. Those are the only things that I have on that. Other than that, I thought your report was good, and where we're going, but we need to have that kind of information as we go forward. Thank you.
Thank you, Commissioner. I really appreciate the support, but also the questions. I think to answer The first one about why a veto happened on AB 92. A lot of the bills that were vetoed this year that had any budget or cost to them were vetoed because of a projected recession. That was part of the message in AB 92's veto, but also the budget and reimbursement rates for childcare workers has been an issue and a negotiation issue, and is top priority for the ECE coalition as well as us. I know Becca Patton, wherever she is happy to hear you say family, friend, and neighbor and wages is a priority, and we hear that loudly, and we'll carry that into next year too.
Also, the issue for this the equalization of cost up and down the state, so that when families want to do it, we're not going against the Middle Valley people and all this nonsense. So that equalization is very important. It's very important. So I don't want you to give up on that either.
You know us, we will not give up.
Thank you, Romelis. I have just one question to ask. It could be either now or it could be after the break, since we're going to talk about strategic plan after the break. But I've been on this commission now for, I think, almost 5 years, something like that. Time flies when you're having so much fun. But I'm looking at our strategic plan when we came in. I asked this question when I got on here, was that it says we are focused on results for children and families. And we have 4 things there. Families optimize their child's development. Children receive early developmental support and services. Children are safe from abuse, neglect, and other trauma. And children have high quality early care and educational experiences. I am going to raise this issue again. And I heard Andrew, when you reported that we're not going to make any major changes in our goals and our North Star, et cetera. But in light of a lot of what's been in the news lately, including the defense stance in Florida over the boy that killed all the kids in high school there, et cetera, I believe that we ought to be bold enough to take a stand against fetal alcohol spectrum disorder, since it is the #1 cause of developmental delay in children in this country. And we aren't addressing that. I know that the governor is beginning to pay attention to that, but I think that we ought to be bold, and we are that voice. And we know, honestly, we're doing a lot of experimental stuff here. We know our only chance to divert those kids from foster care, juvenile justice, and ultimately San Quentin is if we get them in the first 5 years of life. And if we don't take a stand on that, I don't think we're doing our job. So I'm going to put that forth again. I'm going to repeat it again in half an hour. But I'm just saying is that I know we don't want to change things, but I don't know that we were talking about FASD before I came on the commission. You can correct me if I'm wrong, but it is now becoming a national, recognized as a national tragedy. And if we don't take a stand on it, we're going to be behind the scene. So we can talk about it more in item 7. Item 6 is a chance for everybody to go get a snack and a few other things. Linda, are we okay with taking a break now?
Yes, before we do break, I wanted to confirm for the record that there are no public comments on this item.
And Astrid, if we may, before we break, Sharna might have some initial thoughts or others to share. I saw you went off mic.
Right. Okay.
Sharna.
All right.
Thank you.
I would love to talk about this offline as well, but do want to highlight that you definitely have us thinking a lot more about FASD and about substance exposure. One of the things that we did and spent some good time with in coalition this year is around the early start eligibility changes. So it wasn't just moving the developmental delay down, but presumptive eligibility for FASD. And we brought that to the table consistently. We do see it embedded in our policy agenda, and we hear you that you'd like to hear more and explicitly, and we definitely agree with you on early intervention and prevention on that. So I hear you, and we have been making efforts. We will do a better job of elevating them.
I know the governor's alleged today or tomorrow to sign a bill into law about recognizing a little bit of the older group and getting them in, access to the resources that they need to qualify for special education, et cetera. And I'm all for that. And I'm a big proponent of that. But we spent a lot of time talking about equity and equality, et cetera. And I'm sitting here looking at the statistics and the data on the kids most impacted by FASD, and they happen to be a minority population in which they have been in the inner city and not have access to good food, and they buy their food at the liquor store, et cetera. A lot of loneliness, a lot of poverty that contributes to all this. But I'm actually frantic about putting a stop to this. And we put in we'll see, I'll let you know in December, of course, for money in support of building this preschool, therapeutic preschool for kids 0 to 5 with FASD, not only to treat them and try to see if we can't get them, to function high enough that they're not going to be in the foster care system, but also as a means of training and teaching, since we're the only place in California doing both of it. I get I feel really a little desperate, but I appreciate it. And I won't mention it again this afternoon.
Astrid, Commissioner Taylor's hand is up. I don't know if that's a holdover, Ramalis, or you have something to add before we break.
Before we break on this issue, I want to know that we're capturing some data on this issue, since it affects the minority communities very strongly. And I wonder if Kimberly Hall can tell us if she's capturing some data on this, so we can know how it's affecting and what populations are being affected by this and where in our county. This is really a critical issue. Kimberly?
Yeah, thank you for the question. Currently, we're not capturing data on FASD within the 0 to 5 population. As you might recall, as a part of the impact framework, we were looking at a number of conditions, what we called our contextual indicators, things that we wanted to understand about the 0 to 5 population and their families. Rates of FASD were not any of the indicators that we were capturing. And I will share that as we refined our strategic plan and we start to identify what we're going to focus on strategically in terms of our outcomes, we will be reconsidering those factors that are going to be important for us to monitor moving forward. And so we will certainly consider that on the list in terms of if it's something that we want to monitor systematically as an organization so that we can look at rates over time.
I think it's going to be important that you do that so that we can know who's being impacted and where in our county is being really devastating to these communities of 0 to 5 for these children, especially since we're now focusing on 0 to 3. It's critical, just start to bring that up.
Yeah, thank you for lifting that up.
Kimberly, come talk to me anytime. I'm happy to tell you why I became the zealot that I became. It's the same reason why I did not go into pediatric oncology, that I'm now sort of perplexed at myself, because I didn't go into oncology because when I was a resident, 90% of the kids died of cancer. And now we save over 90% of the kids. And they said, don't ever do FASD because you can't treat it. And I'm not going to accept that. And as we get smarter, we're realizing if we can capture these kids by the time they're 3, certainly, by the time they're 5, that we might be able to actually divert the trajectory towards San Quentin. So we can come talk to me, or give me a holler, an email. And I know it's a terribly boring subject, but for the families whose kids were killed in Parkland, Florida, it wasn't all that boring. So anyway, get in touch with me, and we're going to take a break now. If there's no public comment, Linda, no public comment.
Confirming there are no public comments on this item.
Oh, thank God. And we'll take a break, and we'll try to come back at around 3:05. All right. Thank you. So are we almost on time again?
Yes.
All right. My clock says 3:04. What does yours say, Linda?
3:04 as well.
Well, it's nice that our cyber links are accurately attached to one another. You know, one of the more fascinating things about being faculty at SC, just not to comment on the recent stories in the LA Times, is that my Gmail account gets to me right away. But if it goes through my SC account, it could be delayed for 3 to 5 days. I've never been able to figure out, you know, the academia of all that, but it's a fascinating thing. So if I don't want to hear from you, I'll give you my USC address. And if I do, I'll give you my Gmail. It's crazy. All right, it says 3:05. We are back on item 7, and that is a strategic plan review and refinement. Review and refinement cycle, just what I wanted. Discussion on proposed refinements to First Five LA's 2020 to 2028 strategic plan. I'm going to throw it over to Antoinette and let her take it away. And I'm looking forward to hearing what you have to say. It'd be exciting. Thank you.
Thank you very much. And good afternoon, commissioners, and good afternoon to my colleagues and members of the public. We have greatly appreciated the board's thought partnership through this initial phase of our first 3-year strategic plan review and refinement cycle. So today we're going to really focus on our draft long-term systems outcomes, which during the July and September board meetings, commissioners really expressed interest in learning more about. So we're going to talk about that today based on what we've heard from commissioners and staff, as well as data and learning from our various partners. And we'll also talk about some next steps. Now, before we get into the core content for today's meeting, I'm going to share a few framing remarks about where we've been, where we are now, and where we're going. In July of this year, so next slide. In July of this year, we launched the first 3-year review and refinement cycle as indicated in our 2020-2028 strategic plan. Earlier this month, staff shared refinements to what we call the foundational elements of the strategic plan, which I'll cover in the next slide. And so this is where we've been. With those foundational elements in place, staff returned, thank you, sorry. So with those foundational elements in place, staff then turned attention to an initial draft of long-term systems outcomes, and this is where we are now, and it's the focus of today's presentation. During today's discussion and continuing conversations with staff and key partners over the coming weeks, we'll inform what we bring to the board as a preview, what we bring to the board in October as a preview for board approval in November. And I'll return to this at the end of the presentation. And then post-November, the next step is to refine other elements of our strategic plan, such as the strategies, investment guidelines, our values, and our long-term financial plan to strengthen and further narrow our work for greater impact. Next slide. During the July and September board meetings, staff discussed the foundational elements of the strategic plan, which include a reframed North Star grounded in child development, a logic flow for how we will achieve our North Star through a systems change approach grounded in a shared problem statement. We talked about the unique positioning and perspective that First 5 LA brings that helps us to determine the focus of our system, of the systems change work that we want for greater impact. And we talked about the opportunity before us that informs long and short-term systems outcomes, and we'll discuss the long-term systems outcomes today. Next slide. During the September board meeting, commissioners shared their insights and perspectives. Now, I will not go through each bullet on this slide, but I'd like to call out 2 important points here. The first is how we engage communities in the process. And the second is what data and learning we're using to inform decisions about our thinking and ultimately what we have as our long-term system outcomes. So the point about data and learning is particularly noteworthy for today's meeting. Now, during the board meeting earlier this month, I used a colloquial phrase, throwing spaghetti on the wall. And in fact, I referred to different types of pasta. Now, that informal language did not appropriately convey the intentionality with which we are discerning how to focus and narrow our work for greater depth and impact in the context of our fiscal reality. Our evolving thinking and what we've been bringing to the board is grounded in what we have learned from strategic plan implementation, as well as what we're hearing from communities and partners. We've been considering an array of choices for what First 5LA can do to improve public systems so that they work better for families. Understanding that in order to focus and narrow our work, we must make strategic decisions about what we will and will not do based on what we believe where we can have the greatest impact. And these strategic decisions have to be grounded in data and learning, as commissioners have noted. Now, Tara is going to share some of the data and learning that has been informing our thinking, as well as what we're going to talk today about our systems change goal and long-term systems outcomes, which Kim Hall and my other colleagues will go into detail. So I'm going to turn it now over to Tara.
All right. Well, thank you, Antoinette. Yep. Thank you, Sharna. Since April of this year, staff have been working to refine the 3 components of our strategic plan noted here in the top unshaded section. They are our North Star, our results for children and families, and our long-term systems outcomes, which are labeled on this visual as what we want systems to be. As Antoinette mentioned, the other strategic plan components, strategies, investment guidelines, values are forthcoming, but the decision to start the refinement process with the North Star and the outcomes was anchored on the need to be crystal clear on what we are trying to accomplish and why. Learning from the past 3 years of strategic plan implementation is pushing us to further define our impact while also narrowing our focus. Therefore, beginning with outcomes was a necessary and appropriate starting point. Next slide, please. So as we move through this strategic plan refinement process, we are developing a whole child, whole family approach to guide us. We are focused on the well-being of communities, which we know is inextricably linked to the well-being of caregivers in promoting and ensuring healthy development in children. And as we've refined our North Star, defined our unique position and opportunity, in a few slides, you'll hear about how we're developing our draft system outcomes. We center the care and development of a growing child, as well as the stability and strength of the family, including income supports and employment, and the well-being of caregivers and the well-being of their communities. We know children need safe, stable, and nurturing relationships and environments from the earliest moments, and that families want what is best for their children, but are often limited by the conditions surrounding communities. In this whole child and whole family approach, we are also thinking about the conditions that help or hinder development reflected in the blue circles here. We know this is not an exhaustive list of conditions that surround the community, caregivers, and children, but reflects a range of conditions that influences the opportunities to provide or experience safe, stable, nurturing relationships and environments. This visual is our attempt to recognize that there is a direct connection between the well-being of communities and the well-being of caregivers in promoting and ensuring healthy development in children. And this approach has and will continue to guide our decisions throughout the strategic plan refinement process. At our last presentation, we heard you commissioners and the request to hear, and as Antoinette noted, to hear more about the data and learning staff is using to make decisions about the systems we're prioritizing and the outcomes we will
Hi,
commit
Dr.
to.
Hager, how are you?
We also heard where is community voice? We also heard, as Antoinette mentioned, where is community voice? What is community including? Community caregivers and providers, what are they saying to First 5LA about work and experience to date? This slide and the next are going to dig into our learning from data and community. As you see here, staff is looking at county and community priorities to identify alignment to inform where First 5LA can further contribute and maximize efforts underway. Many of the county priorities were pulled directly from board action and are further detailed in the appendix, while the community priorities were identified through our Best Start Learning series and regional network prioritization process. The takeaway is many common priorities exist between county and community. Given First 5LA's unique position and perspective, we must continue to focus on how we can best use this data to inform our outcomes and subsequent strategies. Additional data and learning we are using to inform strategic plan refinement is surfacing from current and past community engagement efforts. This slide reflects experiences and insight from First 5LA staff, communities, families, childcare providers tied to publics and their experience tied to public systems. To give it your full attention though, and not gloss over, I am going to pause for a minute so we can read and process on our own because there is a lot of information here. So we'll just take a minute. Everybody can read and process on their own, and then we'll start up and identify themes. So some themes that cut across the feedback include community-based services and outreach are inadequate, and using them is administratively and emotionally burdensome. Mistrust surrounds public systems on the part of families due to their experience, how they are treated, and the reverse, public systems mistrust families given they are designed to manage, limit, or catch misuse. Stigma exists. It's associated with accessing services and support. Policy decisions, while good intentioned, can have negative implications on providers and families, influencing the level and type of supports. Reimbursement rates, eligibility cliffs, limit families and providers, perpetuating poverty and the inability to meet basic needs. And finally, participatory process, co-creation and decision-making with communities is uncommon and or ineffective as it doesn't result in actual change. This feedback from community is shaping the development of our overarching systems change goal and our systems change outcomes. And I'm going to pass it now to my colleague, Kim Hall, who's going to dig into that further.
Thank you, Tara. So now that we've heard about what we've been hearing and learning, we're going to transition to a discussion of our current thinking about systems change outcomes. Since Tara's already described the whole child, whole family perspective represented in the visual at the center of this slide, I won't repeat it. Rather, I want to note that it's here because this perspective grounds our consideration of key questions as we work to narrow and focus the systems change outcomes we will pursue. These questions address what we want public systems to look like and how we want them to function. And importantly, we are also asking what we want children and families to experience in these public systems. Answering these questions is helping us to get to the level of clarity needed to specify the system change outcomes that are essential to advancing our refined North Star. Before getting into the draft system change outcomes, I want to first orient you to the emerging systems change outcomes framework. The framework has 3 levels. At the top is our overarching systems change goal. This reflects what we want transformed public systems to look like from the perspective of children and families. It is the highest aspiration that we have for public systems and the goal from which all outcomes flow. Beneath our overarching systems change goal are long-term system change outcomes. These broad outcomes articulate the characteristics we believe public systems must possess in order to achieve the overarching systems change goal. We recognize that achieving any one of these outcomes within even a single system is no small feat. And we know that to do so, there are wins we must achieve along the way. Those wins we must achieve along the way are referred to as short-term systems change outcomes, which are reflected in the 3rd level of the framework. Short-term system change outcomes have a greater level of specificity and are going to be the measures of success related to our strategies and tactics. So going from top to bottom, we will achieve short-term system change outcomes through our strategies and tactics. The short-term system changes will contribute to public systems possessing the characteristics that are specified in the long-term system change outcomes, and the long-term system change outcomes will enable the overarching systems change goal. I want to note that while this framework appears to be very linear, it's imperfect. It's a 2-dimensional representation of our thinking. In fact, we fully acknowledge that there aren't clear one-to-one relationships between short-term and long-term system change outcomes or to the overarching systems change goal. On the contrary, the relationships are multi-directional and messy. But what's key is that the framework reflects what we believe is important to achieving the outcomes that we will relentlessly pursue. And it reflects the kind of sequencing and building upon that we think is necessary to achieve the overarching systems change goal. So next slide, please. In just a moment, we're going to pause to hear your reactions. But before we do, let's focus on the draft overarching system change goal, which is public systems most critical to the development of children prenatal to 5 are transformed to advance justice and belonging with communities that have historically been harmed and excluded. Now, you may be wondering, why do we need an overarching systems change goal? Well, we believe that such a goal expresses the transformation that we seek. That transformation is the elimination of systemic bias and inequities within public systems. This overarching goal also guides the development of long and short-term system change outcomes. And finally, it encourages us to shift from a mindset focused on fixing discrete problems to one focused on transformative systems change. So we're now at the point where we'd like to pause to hear your reactions and engage in discussion. Keep in mind that a deep dive on each of the 4 draft long-term system outcomes is coming up next. For now, we're eager to hear your reflections and to know what needs to be clarified and what's missing from our outcomes framework and our overarching systems change goal.
Can I, hey, Kimberly, this is Dr. Hager. Can I ask you a question? You know, when I'm beginning to realize why, yeah, okay. I hear all of that, and those are great. I wish we would have systems change. I'm sitting here a little bit discouraged. How can First Five, how can we influence major changes in how we approach the communities that have been marginalized? What role do we play? What influence do we have? What power do we have to bring about change across the various agencies charged with the responsibility of the safety and well-being of families and children? How do we do that?
I think that is the million-dollar question. I think that we bring to bear the resources that we have. You know, we've talked about how we are uniquely positioned and kind of our charge. We have assets throughout the organization in terms of our staff, our relationships, our what we understand about the context and the policy environment. And I think what it is going to take is us bringing all of those resources to bear in a really integrated way and working in partnership with others in our context. I feel like there is a much more detailed answer that can be provided. And I think that's what we're really working towards answering as we will be working towards answering as we land on outcomes and think about how to best refine our strategy in order to achieve those outcomes. But I do want to look to any of my other colleagues on the panel to see if you'd like to weigh in.
I can weigh in here. So one of the things that we have brought to the board is First 5 LA's unique position and perspective. The fact that, as Kim mentioned, we do have relationships with public system partners who sit on our board. We have relationships with others, as the OGAP team elevated earlier in today's meeting. And as we move to the next parts of this presentation, you'll get a little bit more specificity, because the way we're thinking about transforming systems is through, as Kim mentioned, with this outcomes framework, really looking at what are the long-term system outcomes. So what are the characteristics of systems that we really want to change? And then what are some shorter term outcomes, which we won't get into today. And then what are then the strategies? So, as Kim noted, it is a question that we are grappling with. You're pointing to a number of choices that are before First 5 LA based on our unique position and perspective. And it also points to the need for us to really focus and prioritize our work so that we can have the impact that we seek in transforming public systems.
Okay.
Commissioner Taylor and then Commissioner Byrd.
I've already spoken a lot. I'll come back. I'll yield to Commissioner Byrd, and then I'll come back.
So I actually wanted to comment on the question that was asked. I think that in terms of systems change that Dr. Hager raised, I think we're in a unique opportunity right now, both at the state level and the county level. I think the Prevention Services Task Force affords a new opportunity to really look at how we do some of that way upstream system change, right? How do we create a vision for LA County that takes some of these pieces of the North Star and starts building them out to address, measures of well-being and like changing our systems a little bit. I also think with CalAIM, Dr. Hager, when you were talking about FASD, I was wondering how much advocacy has there been at the state level around CalAIM, and including like screening tools, as part of that package or services, because I think CalAIM brings a lot of flexibility in terms of how do we best serve the population of California.
Robert, you know what? Away from this commission. Oops, that's my phone. Sorry. Maybe you and I could agree to have a conversation about this, because I think it does impact greatly what happens at DMH, and certainly I'm talking, with the UCFS about this now as well. But I really would, maybe you and I could really address this in terms of it being a crisis in mental health issues for these kids, particularly the really young kids. So I'll tell you what, I'll email you after today, and you and I can perhaps get together and have that conversation. But your point is well taken, and it's now getting a little attention in Sacramento. But we tend to not talk too much about the 0 to 5 kids. We're talking more about the kids that become a nuisance, and then we figure out ways to fix them. But we could only fix them if we got to them before they're 5. So let's have that. I would love to talk to you about that. I'm just talking to you anyway. So let's I'll send you an email. Okay.
Commissioner Allen and then Commissioner Taylor.
Thanks. I wanted to say a couple of things. One is to really support what Robert said, that there is this very active conversation going on in the county about exactly these questions. And I think, this very important point that you've made, that on the one hand, for example, you look at entitlement like food stamps, and there is severe sanctions for fraud, and there is no accountability for assuring maximum participation. So, there are ways of creating metrics that say, at least at a county level, we're committed to assuring maximum use of some of the programs that are available and that could change outcomes for families. And that discussion is going on now. I do want to make one other point, though, which is that it seems to me that the conversation as framed so far highlights making maximum use of the resources that are currently available, and that there are important limitations on those resources, that most importantly, there is no entitlement to housing, that we have, we have entitlement programs for food. None of these are perfect, but we have entitlement programs for food, we have them for education, we have them for child welfare services, if you could call that exactly an entitlement, and we have them for healthcare. Very importantly, even though those are inadequate, we have none for housing, and that in this county, we have to be looking at that and not simply looking at improving the very, the systems we do have, important as they are. So I think thinking about it, this is an answer to the question, what's missing? And I think what seemed to me to be missing is looking at what are the places where the system is currently configured isn't just not acting optimally, but where we really have not grappled with the way families lead their lives and what they need.
Romalis?
Okay, I want to go back to some clarification and some statements in the goals. I think the goals are too generic and they don't lead itself to action that we can all hold ourselves, not only us, but our collaborative partners. To speak to Astrid, this organization has a great background and skill of collaboration across systems once we focus on something, and getting people to come together and integrate their approach to services. So rather than things being siloed, collaborating, thinking out of the box and figuring out what changes are needed. What's the barrier here for families is we're talking about families that don't understand government systems. So we need to facilitate. And what do I mean by that? You are already modeling and Help Me Grow. Don't throw anything at me, Tara, but Help Me Grow shows that kind of total collaboration I'm talking about. What we found, I take that back. What you guys have greatly found is that systems have operational gaps that don't connect one service to another. And therefore, the children and families fall off into this great abyss that says they don't get what they need. So the end result is we paid for something to fill that gap, to model the concept of what needs to be there, that we once prove and capture the data. We can go back to the state and say, you need to pay for this, and it should be in the budget of whoever's budget to be that navigator between systems or facilitator between systems, so the families don't fall off the gap. What do I mean? Regional center. If the child is assessed over here as needing, for example, regional center work, that facilitator makes that connection because we have a collaboration with our partners who understand that gap exists and is willing to partner with us to show how it can be done better and how many children and families don't fall off into that gap. And the child has a better trajectory to success. The more we capture that data, the more it is. So there's a huge facilitation problem from one system to the next. Example is, if I'm over here in child welfare, but there's no facilitation to DPSS. And there's no collaboration for that particular family, that child, to keep them out of the child welfare system. So it's kind of like when you go to that, oh, if they need help, there's no facilitator between that system and the other system, which have their own codes, which families can't navigate. And you tell, so what the system tells them is go here, go there, and do that. And you expect these people to do it, and they don't understand it, and they don't know how. And the immigrants is even much more huge. They're terrified to even engage one of these systems. So the end result is we need to make sure that these things are more culturally relevant and appropriate to engage the family. So I'd like to see the statement to be more outcome driven in the sense of what it is. I just think it's too generic, and facilitating it is important. I've kind of made some write-ups on this, but it's just too long. And I think you guys could do a better job. And I can tell you that off things, but I'll give you a thing on just going to your page where you have all of the page 13. When you look at this thing and it looks at outcomes, you should say all of the things you said, but like for public systems are connected, coordinated, seamless, and facilitate easy access for families. That's an action thing that everybody can sit down, all our collaborators, and say, how can we do this? Not dictate, but say, how can we collaborate to do that? Another one, you say public systems are responsive to the needs, experiences, and facilitate access of families and communities. That's action. If we don't see that facilitation, it's not happening. Again, another one that says, at the end, you say the financing mechanisms of public systems are equitable and incentivize a whole child, whole family, and prevention-oriented approach and services. And what do I mean by services? That's where our DEI pops in, right? So we, without saying it, we're leading and services because we can then measure, is it culturally relevant? Is it equitable? Is it this or is it that? Then you can go on the last one. And I'm just throwing these out as suggestions. I'll let you great geniuses tell me what you think you need to do. But I think we need to go one step further and get an action-oriented outcome. Families and communities are engaged and help to change public systems, not share influence and share public systems, but they help to change public system. That gives them voice. So is there a voice in all these systems that the family is honored and heard, and then they take into account how we can collaborate to improve the system? Because I'm going to tell you now, nobody's checking and child welfare. Is the system really meeting the needs? And are they checking themselves to change it, to improve it? That means changing policy, procedure, and practice to do that. And when is the last time these systems ever edited themselves to see if they're doing that? And not negative, but I'm saying like we going through this review constantly, and I've learned that from you. You keep looking at what we're doing and we're measuring ourselves and we're looking at what it is. But we have to get other systems to start doing the same thing, on and on and on. So we can have not just to take a shot, but we can have quality improvements for the whole family. And by the way, whole families is recognized, whole child and whole family is recognized by the state, and they're starting to talk that way. So that integration needs to be going on. And so we need to collaborate that with our partners to do that. And what does it mean and stuff? Because what you have is different systems having different values that are not of any essence to the family, because they're looking at it like someone has already said, oh, we got to make sure nobody steals. We got to make sure of this and that. But if we start at the youngest child and perfect that, then we can all claim success for the trajectory of children and families going forward. Just a thought. I hope it's not a criticism, but I think we need to have that kind of thing. And I think the statement of our goal needs to be written in an action-oriented approach that includes these things. And I wrote something, but it may not fit in the way you're talking about, but you get my point. So I'm just suggesting that we need to have action-oriented. If we're going to talk to someone about our goal, if it's not action-oriented, what does it mean?
Yes. Thank you, commissioners. And Commissioner Taylor, you've given us some really good food for thought. And as we go through the remainder of the presentation, we'll do a deeper dive into each of the outcomes that you shared feedback on. And that will give other commissioners as well an opportunity to look at what Commissioner Taylor is saying, as well as what staff will be presenting. One thing that I just want to return to is what Commissioners Byrd and Commissioners Allen said, as well as you, Commissioner Taylor, around collaboration. So the question of how do we get public systems to change, what I want us to focus on is the we. So First 5LA is, as Commissioner Taylor noted, collaboration is one of our organizational goals. We cannot accomplish these goals alone. And so our participation on in various county efforts that are currently underway, the relationships that we continue to cultivate, it really is around how do we work in partnership with others across the county and within communities who, as Tara noted, there's a lot of concurrence between the priorities that the county is uplifting, as well as the priorities of communities. So, and so communities are also important partners in helping to drive the kinds of systems changes that we all collectively seek. Commissioner Taylor, we have noted that our goal, our systems change goal is vague and needs to be more action oriented. So that is duly noted. I don't know if there are other commissioners that have specific feedback around our systems change goal before we move on in the presentation.
Let's go ahead and dig in, Antoinette, to the 4 long-term systems outcomes that Commissioner Taylor was kind of you're getting ahead of us a little bit, Ramalis. You're often ahead of us. But I think the team really wants to kind of go through each of the evolving long-term systems change outcomes and ask some similar questions of commissioners.
Thank you, Kim. So as we dug into what the long-term system change outcomes are, I also want to restate that the discussion today really represents our evolving thinking, which extends to the refinements to our long-term system outcomes as well. But we know the words are not perfect or that they're final. And we're continuing to refine the outcomes based on the feedback from staff and from what we hear in our conversations with you, our board today. So what we're bringing is our current best thinking, and it's very conceptual. So it may look substantively different from what we bring to the board in October when we are back with you with new content. So beneath the overarching systems change goal, we have the 4 longer term system outcomes that are meant to clarify the longer term achievable system goals that we are aiming for. And while we recognize any one of these goals and any one of our public systems of focus is really, really big, we know that these are long-term and interrelated and interdependent. To Kim's earlier point, nothing is one for one or linear, and they're very complementary and reinforcing goals. The long-term system change goals are meant as descriptions or of the characteristics we want systems to change into. So while our strategies and shorter term measurable goals will be more active and actionable, they will be more discrete and tactical so that the combined efforts of the short-term goals are aimed at the interrelated characteristics we want to see. I hope that made a little sense. So as we aim our focus to impact public systems that most closely impact child development that we want, Our first one was about public systems are to be connected, coordinated, and seamless, enabling, and we hear you, facilitating easy access for families. This characteristic or long-term system outcome is aimed at continuity, that public systems are aligned to provide the continuity of services both across and within systems. The shorter term outcomes to pursue this systems transformation could be around streamlined eligibility, reducing duplication or contact points, access barriers, the multiple entry points, so to provide single point access or integrated comprehensive sense of services. Two, the next one, public systems are responsive to the needs and experiences and assets of families and communities. That public systems are designed to ensure the full and equitable utilization of supports and services by families, aimed at connectivity between families and communities with appropriate and meaningful supports, but also that full utilization we were just talking about would be a shorter term goal here. It would also be that public systems offering a range of settings and providers and service types to meet the needs and preferences of children and families. Number three, the financing mechanisms of public systems are equitable and incentivize a whole child, whole family prevention-oriented approach, which does include services, systems, and a range of benefits. In some systems, increased investment is a large priority to ensure providers, caregivers, and families have economic stability and security. However, financing mechanisms are more than just increased investment, which we know is needed. So looking at sufficiency, equity, and stability. These mechanisms can also include intentional incentives or sanctions, to Commissioner Allen's earlier point, to prioritize prenatal to 3-year-olds and children and families who live in communities that are under-resourced and experience inequities. And our fourth long-term system outcome, that families and communities are engaged and have influence shaping public systems. We are thinking about this outcome as the other side of the coin for our outcome number 2, that public systems are designed to ensure full and equitable utilization of supports because it goes hand in glove. For public systems to have structures and processes that institutionalize meaningful community participation. And power sharing, that communities gain power to influence and hold systems accountable for equitable strategies and resources and outcomes. So tried to go fast, but want to ask you to pause for a minute now that we've walked through a little bit more of our thoughts behind each outcome. We know the words aren't perfect. Do they resonate with you? Do they reflect the outcomes First 5 LA should relentlessly pursue and be accountable to? What needs to be clarified and what's missing?
Are there any comments? I have a multitude of ones, but I have sworn to myself to silence now. So does anybody else have anything else to say about this?
I hope you don't withhold them from us, though. We would like to hear from you at some point.
Well, I was frantically looking for my report that I wrote to the Blue Ribbon Commission, 14 years ago or something like that, about exactly all of this. Step number 1, build a community advisory board in every district. Actually, identify the resources that are present in the community that you can tap into. The idea of community, across the board community engagement, that there's a commitment regardless of what the cost is, that every family and every child is important. I went down the whole list of things and it was all incorporated in the Blue Ribbon Commission report. And, so I'm not going to go any further than that, but that was like 14 years ago, I think, something like that. And, or less maybe, but it was, everybody said it's a great thing, and it was out of that recommendation that the Office for Child Protection was created. The idea of being able to bring people together, that the different departments would communicate with each other. I respect everything that's been said by everybody here today, but we have a long ways to go to get to a point where we actually collaborate. So that's my comment. I was put on this commission in the 5th district after the deaths in High Desert, and I have a lot of post-traumatic stress disorder over that. And so maybe I'll let Romales take it from here. Go for it, big guy.
Okay, you've already heard my other suggestions, but I want to now focus on page 14, in which you talk about financing mechanisms of public systems and equitable and incentivize a whole child, whole family. If you look at the statements understood, why is this outcome? Well, first of all, they need to be a timely connection. Financing mechanisms includes responsibilities, resource allocation, and oversight, and timely connection to services. When you have these families that are in need, or the child is in need, you can't have bureaucracy, well, fill out this form, find this, find that. You need timely connection or facilitation to timely connection to services so that you can improve the outcomes. The other one is on the last one, sources of funding can be diverse and integrated to improve outcomes. When we collaborate and integrate resources and do it in a collaborative way, we can do more and facilitate more, and we can be creative in getting things done. Sometimes by collaboration, we can do things that bureaucracies can't do, or because of the barriers that the systems or their requirements are limits them to do. So in the result, we can talk about how we can be creative and expand the thinking. But if you don't add integrated to improve outcomes, then we're narrowing our thinking of possibilities. Just a thought.
Sharna, do you want to, I saw your lips moving, but I didn't hear anything. I didn't know if you had some reflections you wanted to share informed by Commissioner Taylor's comments.
I was saying thank you. Thank you. That is helpful. That is good direction. And timely is something that we need to think more about. I think we do feel such an urgency for the earliest moments at birth before deficits can accumulate even more than they already have, and prioritization of the earliest moments, and timely is something we need to consider. So I really appreciate that feedback.
I have to tell you, I just found what I wrote to the Blue Ribbon Commission, so I'll send it to you.
I would love to see it. Thank you.
Do we have any other comments? If not, we have some other parts of this presentation, correct?
We do. Antoinette's going to bring it on home for us.
Yeah. Thank you, Sharna. So we've done a deep dive on draft systems change goal as well as long-term systems outcomes. And so we're sharing this slide again to reiterate the connection between the systems change goal, the long-term systems outcomes, and the short-term systems outcomes. This has been the focus of our work to date. Once we're going to bring this to the board, and I'm going to get to this in a minute, we'll be bringing the systems change or the systems goal outcomes to the board in October, and then again in November for board approval. It is after that we're going to start working on really diving into the shorter term systems outcomes and the strategies that are associated with those outcomes. So we are at a point in time in our strategic plan refinement process where we're focused on what it is that we want to achieve, what's the impact that we seek, and then based on that, we will then move to strategies to really focus and narrow our work further, particularly in the context of our fiscal reality. So clearly there is much more work to do, but what we're presenting here is a more focused, integrated approach to bring sharper clarity and focus to First 5 LA's work and priorities. In terms of next steps, we will continue to refine the long-term systems outcomes based on commissioner and staff feedback, as well as further exploration of what we're hearing and learning from our partners and communities. And we will bring the foundational elements, including updates to the long-term systems outcomes to the board in October. And those systems outcomes that we bring to the board will reflect refinements based on today's conversation, as well as continued staff work. We will bring the foundational elements, including updates to the systems outcomes, to the October board meeting to preview the elements for which we will seek board approval in November. In October, we'll also share beginning thinking on short-term systems outcomes. Now, in November, we will seek board approval on the North Star and long-term systems outcomes. I know it says that we will seek directional endorsement on systems change outcomes here, but what we're really referring to are the short-term outcomes that will guide our organizational strategy or refinements to our organizational strategies. And we'll be specific about what we're going to be asking the board to approve as well as directionally endorse in the presentation materials for the October board meeting. So I will now turn it back over to the chair for any additional discussion.
We're open to discussion. Does anybody have their hand up? I don't see any. Is there any public comment?
I just have one more comment, and I want to say this is still great work. I didn't mean if you thought I was diminishing any of the great work and visionary stuff you're doing. No, I'm trying to enhance it, focus it. That's all, because you guys did a great job in putting that together. I just wanted to let you know.
I think they do an amazing job of putting everything together. My comments are only, because I'm sitting here where the rubber meets the road, and my vision is obviously from way below, not from above. So sorry about any comments that may have offended anyone. Do we have any public comments at all, Linda? Or are we okay to adjourn?
Confirming that there are no public comments on this item. And before we adjourn, Commissioner Hager, I do want to confirm for the record that for any public comments on items that are not on the agenda, we don't have any public comments for those items either.
Oh, great. All right. Well, thank you, everyone. I appreciate everyone being here and listening to us. And I'm sure that I will hear back from some of you. I did send something to you, Linda, through the internet for sharing. Good luck with that. And I want to tell you, I'm thrilled. For the first time in the history of the Hager dynasty, there will be a female child in this family. One of my sons expecting a daughter. So and she's biracial. So it's really going to be an exciting time for us to have something brand new in our repertoire that we haven't had before. So I appreciate all of you. Some of you I know better than others, and I admire the intelligence with which you approach your jobs, and the diligence and the care and investment in the well-being of children in this county, and that's why I'm a commissioner. So thank you for all of that, and I'll see you next time.
Congratulations.
Congratulations.
Congratulations.